Simply Women's Health with CJ. Today we're going to talk about the 5th month of pregnancy, focusing specifically on weeks 20 through 24. At this point in pregnancy, you are probably starting to notice a little bit of a baby bump. If this is not your first baby, that bump actually showed up a little while back, but if this is your first baby, you are starting to notice that your tummy is starting to get a little bit bigger. You are going to have the occasional cramp, the occasional twinge. It's even okay for you to have the occasional spot of blood after sex. Round ligament pain, stretching pains that happen down deep in your pelvis. Every time you sneeze, you laugh, you cough, you roll over in bed, you bend over to tie your shoes, you can get a pulling sensation down deep in your pelvis that can take your breath away. Perfectly normal. If this is not your first baby, those round ligament pains are much earlier and much more intense than they were the first time around. So what's not okay at this point? It's not okay for you to have 5 or more cramps in 1 hour. It's not okay for you to have water running down your leg that isn't urine. It's not okay for you to have bright red bleeding that's enough to saturate a pad, and it's not okay for the baby to not move. At this point, you are probably feeling fetal movement. If you're closer to 20 weeks, the movement still may be subtle and not on a regular basis. If you're at 24 weeks, that baby is moving all the time. That's what 24-weekers do. You should probably be starting to gain weight at this point. In the first half of pregnancy, I usually tell my patients that I really don't expect you to gain much more than 5 pounds in the first 20 weeks. You really don't have much of an appetite. You really just don't feel like eating. Right around 20 weeks, you should be starting to feel a lot better. Those hormone levels have tapered off, and you are going to start to get a little bit more of an appetite. Expected weight gain at this point is going to be about ½ pound to £1 pound a week. How are you going to do that? Excellent nutrition. Fruits and vegetables, whole grain breads and cereals, lean meat, 10 to 12 glasses of water a day, along with a prenatal vitamin. I also strongly encourage you at this point, now that you're feeling better, to start exercising on a regular basis. I really encourage aerobic activities such as walking, swimming, anything that gets you out, gets you fresh air, and gets that heart rate up a little bit. What's not okay? It's not okay for you to do anything flat on your back. It's not okay for you to work out so hard that you can't carry on a conversation. I don't want any of my patients to do anything that's high impact or that could induce a fall, such as horseback riding, kickboxing, those kind of things. If you are going to work out, I do recommend that you make sure you stay well hydrated while you're exercising. So when you go to your practitioner or your provider in the 20 to 24 week time period, you probably will have already had your anatomy scan, your big ultrasound. Your provider is going to want to listen to the baby with a Doppler at that point. They're probably going to want to measure your tummy with a tape measure. They are going to want to answer any of your questions. I strongly encourage my patients to keep a list. When you think of questions, write them down, whether it's on a little pad of paper or if it's notes in your phone. And then when you go to your OB visit, you can pull out that list and ask those questions, because it never fails when you get into the office, you completely forget what you wanted to ask. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.